Mention eating disorders and our minds fill with images of supermodels, actors, sports celebrities, and teenagers. We often think that people living with bulimia, anorexia, or those who binge eat just want to be thin or have unhealthy relationships with food. But eating disorders are about more than just vanity or body image. There are often mental health issues or trauma involved, and there are more people living with an eating disorder than you think. On Medical Matters today, we're looking at eating disorders and how to manage our eating habits so we don't succumb to them. An eating disorder is not all about food. It is defined by medical experts as a serious mental health condition, and its symptoms involve abnormal eating behavior. You've probably heard of some of the more common ones like anorexia nervosa, bulimia, or binge eating.
So according to the Diagnostic and Statistic Manual, the DSM-5 we call it, there are 5 types of eating disorders. So you have anorexia nervosa, the one that most people know about, the one where the individual would restrict their eating, where you have bulimia, where it is marked with someone who would binge, like a overeat, and then have a compensatory mechanism, whether that is over-exercising, whether that's using laxatives or vomiting. And we also have binge eating disorder that's characterized by binging, but not by the compensatory behaviors that follow that. Then there's also avoidant restrictive food intake disorder, so it's ARFID. That is usually when it's someone who's a very picky eater or maybe struggle with sensory issues. It's usually not body image related. And then the last one is EDNOS. So it's eating disorder not otherwise specified. It's important to realize that although you don't specifically have a diagnosis, if it's a concern, it's still something that needs to be addressed.
While an eating disorder does involve food, it's usually not about food, but often stems from complicated mental health issues. It can also be related to what we do for a living, especially if the focus is what we look like.
There are many factors that lead to eating disorders. Genetics play a massive component, but then it's aspects like, for example, cultural and societal pressures, looking out for the most important ones. It would be your trauma, it would be your coping mechanism, it would be the over focus that we have on body image and body size.
We often associate eating disorders with women, but they can affect anyone, regardless of gender or age.
When we think about how common eating disorders are in the entire gender spectrum, it is something that maybe because of things like stigma, that it's often overlooked. So it's often that men go through this completely on their own, and where we usually associate eating disorders with women, a lot of men slip under the radar, and so the gender spectrum as well. The prevalence of eating disorders are increasing under children, and we are seeing that especially after COVID. That is something that has reared its head.
People living with eating disorders often go out of their way to hide them, but there are some signs to look out for.
We definitely need to make sure that we just look out for warning signs, like if someone is over-obsessive about food, if someone is fearful around food, if someone has weight fluctuations, if there is anxiety when we are around meal times, if someone skips meals, if there are disordered eating behaviors like counting calories or counting macros. If you feel that you are concerned, then it's just worthwhile to urge the person to go seek help.
It's imperative that the right treatment is sought.
Remember, it's a mental health diagnosis, and doctors such as psychiatrists are the ones who are trained in diagnosing eating disorders. So your psychiatrist would be involved, your psychologist, helping you dismantle those thoughts that the eating disorder is infiltrating. You would have your dietitian who's helping with the weight restoration. There's a very diverse treating team, and we all work together quite synergistically.
Eating disorders don't discriminate, and any of us can fall victim if we don't deal with those unresolved issues or continue to buy into unrealistic perceptions of so-called perfection out there. They can be very difficult to recognize and treat, but getting the right kind of help in time could save a life.